Good evening, welcome to Left, Right and Centre. I am Vishnu Shom on the programme tonight. As India's COVID numbers surge, the world comes to our assistance. There's a massive aid package from the United States, but also very big ones and important ones from Germany, France, the United Kingdom, other countries in the European Union and several other states, even our smallest partners such as Bhutan. On the show tonight, the German ambassador to New Delhi joins me in the next few minutes. There's also the head of the US-India Business Council on what Washington is bringing in to India. But first, this report, a reality check on the situation in Delhi, where first oxygen was a crisis, it still is, but maybe just a bit better today. But the battle for beds in New Delhi continues.
माँ मेरी माँ, अब कहाँ ले जाओ उनको ये तो बता दो, कहाँ ले जाओ साले ये गेट ही नहीं खोल ले, 10 फॉर्मेलिटी बता रहे हैं, ये करो वो करो क्या करे? देखा है नहीं पहले फॉर्मेलिटी पूरी करो, मैसेज करो व्हाट्सएप करो, क्या करे? तो देखा नहीं यही बड़े बड़ा चिल्ला रहा पागलों की तरह खड़ा होके, देख लो भाई देख लो.
28-year-old Mukul Vyas brought his 52-year-old COVID-positive mother Kiran in an auto and waited outside the Sardar Patel COVID Care Centre for 3 hours. But he could not get a bed for her. She passed away in this auto. There are 500 COVID beds inside the centre, but people are struggling to get an admission. Many who even got the DSO or District Surveillance Officer's reference for admission as per procedure also had to wait for 4 to 5 hours outside.
सुबह 10 बजे से खड़ा हूँ. हमारे बॉस ने उनके जो मेड है 2 का रजिस्ट्रेशन हो चुका है, लेकिन यहाँ से बोला जाता है कि अंदर से लिस्ट आएगी, अनाउंसमेंट करेंगे जब आपको अंदर जाने दिया जाएगा. लेकिन 10 बजे से अभी तक ये टाइम आ गया, कोई रिस्पॉन्स नहीं आया. ना हम पानी पी पा रहे हैं ना कहीं खाना खाने.
There are no ICU or ventilator beds right now in the centre, and people with oxygen levels below 85 are not allowed, leaving those like 40-year-old Surinder Sachwan waiting on the footpath.
सेंटर बना सरदार वल्लभ भाई पटेल, इसमें भी ये कह रहे हैं ना आईसीयू है ना वेंटिलेटर है ना कोई बेड है, कोई इंतजाम नहीं है, आप ले जाओ अपने पेशेंट को. मैडम 15-20 हॉस्पिटल हो गए हैं, कल से हम लोग ऐसी ये सब ऐसी है मैडम. उन्होंने मुझे रिप्लाई भी दे दिया आप कहीं और ले जाओ, हमारे पास बेड नहीं. हाँ जी, उनके पास मेरे पास मेल है रिटर्न में आया, तो रिटर्न में लिख के दिया उन्होंने कि हमारे पास बेड नहीं है, आप कहीं और ले जाओ.
Delhi Chief Minister Arvind Kejriwal today assured that more ICU beds are being set up across Delhi.
GTB हॉस्पिटल के सामने एक रामलीला मैदान है, वहाँ पे हम 500 ICU बेड्स तैयार कर रहे हैं. LNJP अस्पताल के सामने अपना जो मेन रामलीला मैदान है, वहाँ भी हम 500 ICU बेड्स तैयार कर रहे हैं. और राधा स्वामी सत्संग में हम 200 ICU बेड्स तैयार कर रहे हैं. तो ये 1200 ICU बेड्स गंभीर मरीजों की देखभाल के लिए, ये 1200 ICU बेड्स 10 मई तक बन के तैयार हो जाएंगे.
Authorities continue to assure that there will be more hospital beds and facilities in the upcoming days, but here on ground, families of patients are fighting a battle every day and some lose their dear ones while waiting out on the roads. In New Delhi with camera person Pooja Arya, this is Sukirti Dwivedi for NDTV.
Irrespective of region, age or faith, COVID's deadly toll continues to rise in our country. In Kanpur in Uttar Pradesh, the bodies keep coming in at cremation sites, cemeteries and burial grounds. The rising numbers a stark reminder of the tragedy and scale of India's deadliest pandemic.
Through the night, the pyres burn, the flames piercing the dark sky. In this Kanpur crematorium, as COVID takes its deathly toll, a never-ending day and an endless nightmare for relatives.
अब रात है, कम से कम 40 बॉडी आ चुकी है. आपका नंबर, मेरा नंबर 23 है, जो कि अभी तक नहीं आया. अवस्था ना व्यवस्था सही नहीं है. जो चाह रहा अपनी बॉडी पैसे दे करके आगे करवा लेगा. उनका नंबर है, उनका नंबर नहीं आता.
According to the records at Kanpur's Bhairav Ghat and Bhagwat Ghat electric crematoria, last rites were performed on 528 bodies of COVID victims from April 20th till the afternoon of April 26th. The figures do not include those who were cremated in the traditional manner on wooden pyres.
की बॉडी है आपकी कल शाम की क्या वो नंबर नहीं दिया अभी नंबर नहीं दिया अब लेके गए हैं शमशान घाट को जब कहने सुनने पे वहाँ 8 बजे बुलाया था तो 10 बजे बॉडी आई थी.
There are 35 Muslim graveyards in Kanpur. There are a dozen burial grounds in Chunniganj itself. Lavaris Mayat Intizamiya Society, an organization which deals with unclaimed bodies, says deaths have increased in the last few days.
10 निकल रही है 12 निकल रही. जब इस रोड से 10-12 मिट्टियाँ निकल रही हैं तो और भी रोड है जैसे चमनगंज नाला रोड है.
There are 4 cemeteries in Kanpur. Given that Christians constitute 2.03% of the population, the number of deaths would comparatively be lower. But in Kanpur cemetery, the number of dead is on the rise. In the Chunniganj cemetery, 10 to 12 bodies were usually brought in a month. Those numbers are far higher now.
आपको बता दें भी 3 दिन पहले की बात बता दें 14 मिट्टी लाशें डेड बॉडी ग्रेवयार्ड में पड़ी थी. हमारे पास मजदूर बीमार हो गए कमज़ोर हो गए चोटें लग गई. हमने बाहर से ठेके पे लेबर्स को बुलाकर 1:30 बजे रात तक ये डेड बॉडी गाड़ी है जो कि इतिहास में पहली बार हुआ है.
किसी की कही सुनी बात गलत हो सकती है, कागज़ पे लिखे हुए आंकड़े गलत हो सकते हैं, लेकिन चिताएं गलत नहीं हो सकती हैं. चिताएं तो जल ही रही हैं. एक तकलीफदेह मंजर है. कानपुर में साहिब आलम अरुण अग्रवाल और राजेश गुप्ता के साथ कमाल खान, NDTV इंडिया.
Well, in the midst of this incredible human tragedy, the world is reaching out to help India, several countries, including Germany. Joining us now, Walter Lindner, the German ambassador to India. Ambassador Lindner, thank you so much for joining us. And, we'll talk about how Germany is helping in a moment. But you have a deep association and attachment to this country. This country means the world to you as well. When you see what's happening all around you, what are some of your thoughts?
Good evening, Vishnu and and it's good to be on the show. It's a sad occasion, but I think it's important. I mean, maybe you've seen the quote of the WHO Director General who said the Indian situation is a devastating reminder of the damage COVID can cause. And this is true. I mean, the images you showed just across the world, across Europe, it comes into every living room, and it's heartbreaking. So it's a really sad situation, and it's something which moves everyone. And when the call came from the Indian government to help out to some friends, to help out with some oxygen supplies and some oxygen-related medical things, I think everyone reacted positively. So the fact that I'm sitting here is good, but there could be also other ambassadors sitting here, all those who are providing help. And it shows also that India has a lot of friends around the globe, and India has done a lot during the COVID pandemic to help the rest of the world, producing pharmaceutics, producing vaccines, and now the friendly nations, they return this help.
Sure.
So I think it's just fair we do it.
Ambassador, how is Germany helping us today?
Well, since the government especially focused on oxygen-related help, we are trying to get over now a very big, large oxygen production plant, which is a huge machinery which we have to airlift with 2 massive A400 planes. And I think the green light is almost there. So we are just in the last details of who is handling it here in India, because it's a complex thing. But it will be providing a lot of oxygen to hospitals. Secondly, respirators, ventilators, and large quantities of remdesivir medicine will be provided. I think it's a matter of days just that it's coming. I can expect in 2-3 days we have this here. Then we have private cooperation between the Tata Group and the Linde Group. Linde is the oxygen producers, very famous in the world. And they have teamed up, and they are now bringing 24 oxygen tanks, the tanks which provide oxygen, liquid oxygen between the hotspots. and then the production sites.
Sure.
That's important. And then I guess the Indian Army is also importing from a German company 20 oxygen plants, which will be provided, and the Indian Army is flying them in. Apart from that, we are doing something together with UNICEF on the cooling chain for vaccinations and to keep the vaccines cool and other things. But I think these are the main important thing, because oxygen is what is needed, and the very important word is urgency. So rather today than tomorrow. So believe us, we are working 24/7 to get this.
Sure. And Ambassador, the oxygen generating plant, where is it going to be deployed?
This is now a decision by the Indian government. They have to see, the authorities, where they do employ it and who is handling it, because it's a complex machinery. These are the details which are now which we are discussing with the Indian authorities, the Foreign Ministry, and other authorities, the Red Cross. And so we will see. That's what's happening as we speak.
And Ambassador, when will it be deployed?
As I said, the sooner the better. But as I said, these need to be transported in big planes, and so the logistics might take a few days. So in this case, we might need a few more days to get this on the plane, and then to get this over, and then employ it here. Yeah. But meanwhile, we provide, as I said, the respirators, the ventilators, medicine, and other oxygen tanks. So, but this might take a few days just because of the logistics.
Yeah, and you know, in assisting India, you're obviously dealing at multiple levels. So there's the government, and you mentioned that you're working with NGOs like the Red Cross as well. Is that the plan of the government of Germany to deal
yes.
at multiple levels?
Yeah, listen, we work with everyone who is necessary. We deal, of course, with the government, and they tell us who are the people to employ it here, and then so at the moment, I think it's just a matter of how to get it to the place where it's mostly needed, and this is a decision by the Indian side. We are there to help, and that's what we are discussing in the details at the moment.
A final question, Ambassador. You know, our diplomatic relationship is one of the most fundamental diplomatic relationships that India enjoys with any country. At an hour like this, could you tell us or share with us what some of your top leaders, the Chancellor, what have they been talking to you? Have they been talking to you? Have they been, you know, thinking about how they can help? What's happening in the highest levels of government in Germany with regard to the India situation?
Yes, the Chancellor is very much interested. She's either personally or through her spokesman or through other people around her in contact with us, and to see how we are doing here, how the government is doing, how the people of India are doing, because they see these terrible scenes out there. And she has been here a year ago, and she's a close friend of India. She has been here several times, and she's also a close friend to the Prime Minister. And so she's personally very much involved in this. But also my Foreign Minister, he's involved. He's calling me, and you know, everyone is at the moment on their tiptoes to see, my gosh, what can we do to stop this? In the European Union, so we are coordinating with them as well. So there are many countries who are in the same position as we are, trying to help. And I think it shows the friendships this country has, and the estimation out there for the people of India.
All right, Ambassador, it's wonderful speaking to you, and thank you so much for the people of Germany to reach out to people in our country in this hour of need. Thank you so much indeed, sir. Thank you.
Thank you too, and stay safe. Thank you.
Thank you, sir. Well, a little while earlier on, we spoke to Tyler Pager. He's a White House reporter for the Washington Post, and we spoke with him about the incredible aid which is now being provided by the United States, and it's perhaps the most sizable package of any nation, and we're going to be looking at that. And after you know, this short interview with Tyler Pager, which we recorded just a little while back, we also spoke to the USIBC chief, the United States India Business Council chief, on how that aid would fructify. Tyler Pager joins us, the White House correspondent of the Washington Post. Tyler, thanks very much for being with us. A lot of people here in India were wondering why has it not come thus far, but it's finally come. Before we get to the specifics, what does this say about how the United States sees India as a close ally at this stage.
Yeah, thanks so much for having me. And I think, the United States has reaffirmed in the past few days, as India has suffered what is now the worst COVID outbreak in the world, the United States has reaffirmed its commitment to India, pledging its support and its assistance at this time. On Monday, President Biden and Prime Minister Modi spoke on the phone, and Biden administration officials have said National Security Advisor Jake Sullivan, Secretary of State Tony Blinken have spoken with their counterparts, along with other high-level officials in the past few days and weeks about how the United States can best assist India at this time.
And Tyler, it's interesting that a way has been found to get AstraZeneca vaccines eventually to India, because earlier on there seemed to be legal grounds on the basis of which you couldn't export it. But they seem to have worked that problem. They seem to have sorted that part of the problem, haven't they?
Yes, so the most immediate thing that the United States has promised, in addition to oxygen-related supplies and personal protective equipment on the vaccine front, is the raw materials to send to India to help them manufacture the AstraZeneca vaccine. So that is expected immediately. And then on the longer horizon, the United States yesterday promised up to 60 million AstraZeneca doses exported around the world. So it's unclear exactly which countries will get those doses, but those doses that the United States, its entire supply of the AstraZeneca vaccine, the United States has promised to export around the world to countries that need them. But in India specifically, because India has the manufacturing capabilities to make their own vaccine, the United States immediately is sending over raw materials to help expedite that process.
Right. And what are some of the other key areas that the United States is looking at? And is there a sense of satisfaction that they are dealing with the government of India directly, or would they much rather be dealing with smaller entities, state governments, NGOs, people on the ground?
Yeah, I can't speak exactly to how all the counterparts that the United States is working with in India, but from the readout of the call that we received from the White House about Biden and Modi's conversation, they said it was a warm and positive call in which they both reaffirmed the commitments the countries share and the eagerness of the United States to help India through this crisis. And India helped the United States over a year ago as the United States was dealing with its most deadly wave of the virus. And so I think, there are multiple steps the United States are taking immediately to try to assist, from sending over oxygen-related supplies, testing kits, rapid testing kits, personal protective equipment for medical workers. The United States is also saying that it's going to deploy a SWAT team of sorts of health workers to come help the Indian medical system fight the virus. And then again, I think most crucially is the raw materials for the vaccine. The United States has had quite a bit of success in vaccinating a large percentage of its adult population, and is now eager to share that strategy and those materials with other countries, particularly as it relates to AstraZeneca, which is a vaccine the United States is not currently using.
All right, Tyler, thanks very much for sharing those details with us. Thanks very much indeed.
Thank you.
Joining us now, Nisha Biswal, the President of the United States-India Business Council. Thanks very much, Ms. Biswal, for joining us. I've gone through the package very, very carefully. It's very, very extensive. The critics actually came before the package was announced, and the critics said that why isn't Mr. Biden acting fast enough? But quite clearly, it seems that America is willing to help India in a massive manner. Could you tell us how?
Absolutely. It's great to be with you. And let me just say, first of all, on behalf of the U.S. India Business Council and the U.S. Chamber of Commerce and the business community at large, we are so moved by what is happening in India. As our CEO Suzanne Clark has said, that COVID anywhere is a concern for people everywhere, and that we have to make sure that we are addressing this around the world. India right now has gotten the attention of the entire world, and we are just so moved at the outpouring of concern and support that we're seeing here in the United States. You mentioned the U.S. government mobilization, which is indeed quite massive and substantial, as every asset of the U.S., the military, the diplomatic, the assistance channels are being mobilized. The private sector is launching a massive effort as well. We have created a coalition of businesses across America under the banner of the Chamber, working with the Business Roundtable, as well as, the U.S.-India corridor, the U.S.-India Business Council, and our colleagues at the USISPF, all working together to really galvanize the assets of the business community to support the people of India at this time.
Ms. Biswal, I think the big question that everybody would have is when, given the fact that we have an oxygen shortage for all sorts of reasons, the U.S. Department of Defense says that they want to explore the provision of field oxygen generation systems. Now, obviously, not a minute can be wasted. When is this going to be deployed on the ground and where?
I can tell you that teams are working around the clock on that very question. Certainly the effort that our colleagues have been undertaking to secure oxygen concentrators, we're expecting that the first plane load will arrive in India in the next couple of days, and you can certainly speak to our colleagues at USISPF who have been working on that effort for more details. We know the U.S. Government is mobilizing, and we hope to have more information later today in terms of the assets that they are trying to move and the timeline for that.
Sure.
There is also working across industry with our colleagues at Amazon, at Walmart, at so many companies are sourcing worldwide. Our pharmaceutical companies are looking at global supplies. Our medical tech companies are sourcing global supplies of oxygen concentrators. This is really, and not just the oxygen concentrators, but oxygen cylinders. The oxygen plant that you referenced that DOD is trying to move on, ventilators, as well as the therapeutics and
Yes.
the vaccine announcement, of course, that you heard from President Biden yesterday of trying to source and release vaccines for
In fact,
India and
that's
other
really
global
interesting
crises
because,
as well.
as I understood it, in the past, these were all procured, was the AstraZeneca vaccine as part of Operation Warp Speed under the Trump administration. There were actually laws which prevented these from being exported, but quite clearly this administration is trying to find a way around it and believes it has, number one. And number two, it's just a matter of time. There are quality assurance protocols underway right now, and then a large number of these vaccines will actually come to India. That's my understanding. Is that right?
That is certainly what I am hearing as well, and I will say that I think the President and the Prime Minister discussed the modalities here. I'm not privy to all of that information, but I have seen the U.S. government turn on a massive focus on the global pandemic, and right now India is ground zero in that global pandemic, and all eyes and all efforts are being made to support the Prime Minister and the people of India at this time.
Well, the Serum Institute of India reached out to President Biden directly, in fact, and said that, look, we need natural materials, raw materials, and a way has been found to actually procure that as well, right? So that's going to actually help speed up the process of making vaccines over here. And that's so important.
That is so correct, Vishnu. And let me just say, so the president did say that they are mobilizing the raw materials to support India's production capacity. Of course, the production capacity is an important long-term necessity. And in the meantime, the immediate needs are also front of mind to support the hospitals and the frontline workers of India in terms of their needs, for the hospitals. And then the PPE that's necessary to ensure that there is sufficient protection. We are coordinating very well across the Indian government.
Right.
And I know that the Prime Minister has set up an operation under various government agencies to really facilitate what is coming in from around the world. And we certainly welcome that, because the logistics coordination with the government of India, with the National Security Agency, the Defense Agency, the Ministry of External Affairs, the Disaster Management Agency, and with the states is going to be a key factor as items start to make sure that we are coordinated and we are working hand in glove with the government in making sure that these items get to the people in need.
Well, let's hope it does arrive fast. America's aid so very important at this juncture, as indeed aid coming in from other countries. Oxygen generation plants, perhaps the biggest necessity on the ground at this stage. Thank you very much, Ms. Biswal, for joining us, sharing where American companies and the US government are actually working together to try and help us in this hour of need.